Hey guys, a lot of people have noted that cancer seems to be occurring in younger and younger people, and even doctors anecdotally have had this sense. So this is a really interesting and kind of scary study that just came out in JAMA Network Open that looked at cancer rates in successive generations. So they used a massive US database of 3.8 million people who developed one of 21 different cancers between 1992 and 2018. And they compared the cancer incidence, or how likely people were to get cancer, in so-called Generation X, which is people aged around 45 to 60 today, and baby boomers, who are aged anywhere from 60 to 80 today. And what they found was that people born in Generation X compared to the baby boomers, so the newer, younger generation, had a higher chance of getting a bunch of different cancers: thyroid cancers, kidney cancer, in women, uterine cancer, in men, prostate cancer, colon cancer, rectal cancer, and others. Some cancers did go down, like cervical cancer in women, liver cancer in men, or lung cancer in both sexes. But overall, the net effect was a significant increase in the number of cancers in the newer generation. And this was scary because when they look back at prior generations, prior to the baby boomers, the incidence had always progressively decreased. We were beating cancer. Cancer was happening less often, whereas now in the newest generation, it is happening more often. And the reason this is so counterintuitive is that Generation X smokes less than baby boomers, and smoking is a risk factor for pretty much every cancer across the board, yet that major risk factor has improved, so why have these cancers increased? One of the potential explanations is that we're just better at detecting them. We're doing more screening tests. We have better screening modalities. So maybe people aren't getting more cancers, we're just discovering them more often. But there are other potential scarier explanations for this. The newer generation lives in a more polluted environment. We consume more processed foods, which are associated with cancer. We have exposures to these microplastics in our environment, which people didn't have to the same extent earlier. We also have exposures to these forever chemicals in our takeout food containers. So there are all these changes in our environment, many of which have been associated with cancer, that we have in these newer generations. And remember, this is Generation X. What if this trend continues in millennials and Gen Z? We get into really scary numbers around cancer incidence. We have not beaten cancer yet, and this study is a reminder of that.